Hello everyone, welcome to Treat DM 2025. Myself Dr. Prakash from Diakon Hospital. Here Dr. Keshava R, Senior Interventional Cardiologist, Manipal Hospital, Bengaluru. Sir, today your topic is lipid management, statins and beyond. It is the first question, sir. Should all Indians be on statins?
No. Should not be taken like that. The first thing in a lipid management is still a lifestyle modification. Diet, walking, exercise, weight reduction forms the cornerstone before you start on the statins or any other drug. So until unless you do a good lifestyle management, you should not. And the important thing is to realize that all the trials have been done from 35 to 75 years of age. So only thing is we extrapolate the data into below 35. Many of our MI patient or a stroke patient is 30 years, 32 years. So we don't have a data, but I think we are justified in extrapolating the data and use it for a younger people. So if we are only thing is for a primary prevention, say that person doing a health checkup, LDL is 190, cutoff is 190. If you have LDL of 190, you are justified in starting a lifestyle modification along with the statin as early as possible. Suppose somebody's LDL is 150, 130, a young guy, 35 years, and a routine health checkup. It's important that you encourage him to lifestyle modification, diet, walking, exercise, weight reduction is most important, because you have to realize a 35-year-old guy, if you put on a medication right at young age, he is not going to continue. His dropout rate is very, very high. Almost 50 to 70% of the people stop within a matter of 3 months, 6 months. So you encourage him to do a lifestyle modification, you educate him about the number. See, I'm looking at your LDL of less than 130 by the end of 3 months, 6 months. Then only you start the therapy if the targets are not met.
Thank you, sir. Here is a second question. Do you advise treating an young person at 20 years, T2 diabetes mellitus, with LDL more than 150 milligram per deciliter?
Important thing is to realize all diabetics should be on statin, and the important thing is moderate dose of statin. So moderate dose of statin is 20 mg of atorvastatin or a 10 mg of rosuvastatin. So until unless you don't give a 5 mg, 10 mg of atorvastatin in all these moderate diabetic. So you are a 20-year-old, your LDL is 150. Any diabetic should be on statin. There is no question about it. And you should try to get the LDL reduction of 30 to 50%.
Okay.
So your target at the end of 3 months should be at least less than 100 in this type of patients, so that event rates, all diabetics are equivalent to CAD. So you are a 20-year-old insulin dependent diabetes. So by definition, you will become an insulin dependent diabetes. So he is definitely high risk. So he should be on a statin.
Yes. Sir, are Indian guidelines borrowed from Western data?
No. Indian lipid guidelines is started 2016, and they are much more aggressive than the Western data. Indians in 2016 only come out with a very high risk subgroup, because we Indians are having a CAD at a younger age and a multivessel disease. So the target for a secondary prevention in Indian guidelines, Indian lipid guidelines, is LDL of 50. Whereas Westerners data was around 75, around 5 to 8 years back. Now they have come with 50. We had been come out with our own guidelines, which is much more stricter, much more lower reduction of LDL has been recommended. I think we should stick to our guidelines, which recommend LDL of 50 in a patient with CAD, with acute MI at the multiple coronary events. So Indian guidelines are good and definitely should be followed.
Thank you for your insight, sir. Thank you very much.